working on a very tight timeline, 5 minutes. In fact, coincidentally, it relates to the topic of the, today's talk, like real-time time management. Okay, so within the broad spectrum of IT, I would like to focus on a particular topic called economic technologies for healthcare practice. Okay, so economic, in the interest of the audience, general audience, economic means user-centered. Okay, so within that itself, again narrowing down, voice-enabled health record management system. So, except the weighting factor, voice-enabled, the other terms are self-explanatory. So here, by this, what we mean is we are trying to leverage the potential of automatic speech recognition, the technology behind, uh, in the context of healthcare workflow. That's what. So let us see where we can apply, where it fits in as an appropriate technology. So role of automatic speech recognition as an appropriate, that's the keyword. So I'll try to explain where is the appropriate fitting. Okay, so workflow efficiency. So usability, a very familiar term. So how can we address usability in workflow, healthcare workflow, with technology incorporation? So this is it. The design talks about come out with technologies like voice interface systems, which can act as an alternative input modality to the existing or the prevailing the keying systems. So that's what it speaks about. So effective, it can reduce substantially the amount of time. See, the resource parameter that we are trying to optimize is the key cardinal time factor. So if we can replace the conventional input modality systems with systems like voice interface, where automatically the speech gets converted to text and it gets posted to the database, nothing better than that. Again, see, voice interface, another, why it is a preferred modality. See, we have been used to talking speech, it's a very natural and user-friendly mode of communication, and hence it enhances the user satisfaction also. So with these two main points, the advocacy is positive. Okay, so let us look at a real-time scenario where this is going to be plugged in. See, this is a snapshot of a GUI, a graphical user interface of a health record management, health record, electronic health record. So if you really analyze, I'll try to localize some of the areas. See, it contains different classes of elements, control elements, like the combo box, the radio button, and all that, text fields, okay. But pay your attention to these fields, like the text area, where the clinical documentation in descriptive nature is desired. Okay, so there is a specific area, or a context where descriptive speech, descriptive text is desired. This is unlike the other control elements where too much of discrete quantization is made. Like here, if you take a history and clinical features or treatment given, I have a specimen to show. See, look at that, it's an example. Compliance, sudden onset, vertigo, and fall associated. See, here it's running text. It is not discrete. So here, what it means to say that there are a special context where doctor needs an area to fit in descriptive text. So this is a prospective area for speech recognition to play a positive role. Again, treatment given, okay. These are the specific inputs. So the core technology is the automatic speech recognition. And I would skip the technology part. I want you to appreciate, this ASR, or the automatic speech recognition, is being formulated as a supervised pattern recognition problem. So you have the sound classes, and you are trying to model that mathematically and trying to decode these within a pattern recognition framework. That's what it does. Okay, so coming to performance metrics, if there is an ASR system which can convert speech to text, so by what parameters do we evaluate the system? Mainly by two. See, it's a system, it's not ideal, it has errors. The objective is try to minimize the errors to the tune of what is being desired by the user. So word accuracy or word error rate is being defined in terms of how many substitutions, deletions, and additions that the system makes, and response time. See here, response time for the doctors, okay, they can afford to wait for at least 1 or 2 minutes, in the order of minutes, for the data to come on. And but whereas accuracy is concerned, we have seen that in field assessment within the medical college scenario in Trivandrum, they're nothing less than 95% of accuracy. They are not able to accept the system. So that becomes a crucial challenge for really putting up a reliable acoustic model within the system. So this is what I would like to highlight. See, the whole catchword is Dr. Stanley touching upon the point of data, big data. So we envisage a big role of data playing as in a mining field. Like we'll be able to derive predictive information out of the knowledge, out of the data banks with the use of data mining technologies. So if we envisage a dream of that, so what is the essential ingredient for that? It is just data. So the analogy is like, it's like the catchment area of a reservoir where you need to facilitate inflow of water. So it's like that. If there is a facility you can plug in to ease the flow of data, and if given such technologies which can positively play a role, then it should be appreciated. So that's what. The greater goal is to promote wider adoption of electronic health record with the use of ergonomic technologies. Thank you.